So I'd like to thank Dr. Gilbert and my co-authors for the opportunity to present this research on the adverse tissue response to corrosion and products of corrosion in cobalt chrome dual modular neck hip prostheses. This research was funded by Zimmer and the Rush Arthritis and Orthopedic Institute. Modularity in total hip arthroplasty has become increasingly common in the last several decades. Head neck modularity has become universally adopted, and neck stem modularity has subsequently been introduced with increasing frequency. So-called dual taper stems allow the surgeon to independently control femoral fixation and hip center restoration, as these modular necks provide for adjustment of leg length, offset, and version. Retrieval studies of titanium alloy dual modular necks have demonstrated severe fretting corrosion at the neck stem junction. Cobalt chrome modular necks with titanium alloy or cobalt chrome stems have recently come into use. The purpose of this study was threefold: to determine the degree of fretting corrosion that occurs with cobalt chrome modular necks, to identify the composition of corrosion products generated, and to characterize the nature of the tissue and cellular response in the periprosthetic tissues. 16 cobalt chrome dual modular necks were studied. And these 16 cobalt chromes came from 3 different designs. 2 of these designs employed a titanium stem alloy, and the 3rd design employed a cobalt chrome stem alloy. The modular heads that were coupled with these necks were either ceramic or cobalt chrome. They ranged in size from 18 to 44 millimeters, with the majority of them being 36 millimeters, and they all articulated on highly cross-linked polyethylene. These 16 cobalt chrome dual modular necks were retrieved after a mean of 14 months. And the primary reason for revision was adverse local tissue response. Both the modular tapers were examined. Reflected light stereomicroscopy was used to score the degree of surface damage due to fretting and corrosion. Scanning electron microscopy and energy dispersive X-ray analysis were used to determine the mechanisms of corrosion, as well as to identify particulate debris in the histological slides. The cobalt chrome dual modular necks were scored for the degree of fretting and corrosion. These grades ranged from minimal to marked. The periprosthetic tissues from 10 patients were examined. H&E stained sections were analyzed to characterize the cellular response. So our results. At the neck-body junction, corrosion was seen in 13 of the 16 cases. 12 of these devices were graded as marked corrosion, and 1 of the devices was scored as mild corrosion. In a device retrieved as early as 8 months, marked corrosion was seen, and these corrosion grades increased with time. At the neck-body junction, the damage appeared in the form of fretting corrosion debris, and adhesive transfer from the beta titanium stem to the cobalt chrome modular neck taper. Here, in a device retrieved after 22 months for adverse local tissue response, you can see that the arrows are pointing to areas of marked corrosion. In another example, here you can see areas of marked corrosion again in a device retrieved after 16 months for adverse local tissue response. Scanning electron microscopy reveals severe fretting and corrosion of these cobalt chrome implants. At a higher magnification, we can see the scalloping nature of the corrosion and the dissolution of the alloy. Here, in an example of adhesive transfer, we can see the beta titanium has adhered to the cobalt chrome modular neck. An energy dispersive analysis reveals that this is indeed the beta titanium. Turning to the head-neck junction, corrosion was observed in 11 of the 16 cases. In 7 of these cases, the corrosion was graded as marked. In 1 of the cases, moderate corrosion was observed. 2 of the devices demonstrated mild corrosion, and 1 case demonstrated minimal corrosion. At the head-neck junction, Damage appeared as a dulled surface, and this dulled appearance was due to severe pitting. However, the severe pitting wasn't observed until these devices were placed in an SEM analysis and observed under very high magnification. Here you can see the severe micro-pitting corrosion. The primary reason for revision of these devices was adverse local tissue response, which is characterized by abundant lymphocytes, fibrin effusion, extensive necrosis of the periprosthetic tissues, and in all cases, this was associated with marked corrosion of these devices. Histologically, in the periprosthetic tissues, the joint capsule typically demonstrated a marked perivascular lymphocytic infiltrate. This is similar to the response seen in metal-on-metal devices. At a higher magnification, we can appreciate this intense lymphocytic infiltration. In some cases, the lymphocytes were accompanied by plasmacytes and these eosinophils. This intense inflammatory response resulted in widespread necrosis of the periprosthetic tissues. In some cases, this inflammation also involved the adjacent muscle and resulted in necrosis of these tissues as well. Another characteristic of the periprosthetic tissues was the presence of chromium phosphate corrosion particles. Here, the arrows are indicating the appearance of these chromium phosphate corrosion products on the opening of the modular neck device at where it adapts at the stem. These corrosion products appear translucent, pale green, amorphic, and non-birefringent, and are often very brittle, breaking off in many small pieces. Here in the periprosthetic tissues, we can see these cobalt chromium corrosion products within macrophages, again in the periprosthetic tissues. So titanium alloy necks have often resulted in the fracture of these, of the modular necks. The main issue with cobalt chrome modular necks seems to be an adverse local tissue response, which is similar to what we see in metal-on-metal bearings. Recently, data has been reported on the prevalence of adverse local tissue response. A 15.5% failure rate at 2.5 years was recently reported by Talmo et al. This was associated with the corrosion of the dual modular cobalt chrome necks, and this corrosion was then associated with a smaller stem size, greater neck offset, and increased serum cobalt levels. Another interesting finding of the study was that the use of a ceramic head on a cobalt chrome neck did not preclude corrosion at the head-neck junction. In conclusion, dual modularity offers additional interfaces and increased potential for fretting corrosion. Corrosion of cobalt chrome necks can lead to adverse local tissue response, and every effort should be made to reduce the generation of particulate and soluble products of corrosion. Thank you.
Thank you, Erica. Any questions? So while you're all cogitating on the question you want to ask, I will ask a question, probably a couple. It appeared to me there were a number of different head types there, ceramic, cobalt chrome.
Just ceramic and cobalt chrome.
And there were differences in the appearance of the corrosion from those?
There were not.
Okay. And then, let me think, there was a second question I was going to, oh yes, the correlation between the corrosion in the head junction to corrosion in the neck. So if you saw severe in one, did you see severe in the other?
So we didn't do statistics on that, as there were only 16 implant statistics were kind of.
But you could have scored the severity score of one taper against the severity score of the other and seen if there was a relationship there.
We could have, and we definitely should look into that. I'll
Okay.
speak to my co-authors about it.
Yeah. Tell Josh I said he should do that. Are there any questions? Yeah, Warren. Please say who you are.
Chromium phosphate? Corrosion product?
I think he's referring to the chromium phosphate.
Chromium
Particles?
phosphate corrosion products that we've seen at the head-neck junction. I'm not sure. Metal on metal is not something that I'm particularly aware of other than the tissue response that's involved with it, so I can't comment on that.
I think Urban's work has shown primarily these chromium phosphate particles come out of the taper regions and not from the articulating surfaces.
Right.
Okay, well, if there are no other questions, let's thank Erica again.